Welcome to the next episode of our 1000 NCLEX Questions series. In this video, we will dive into the most important questions related to eye disorders. Our focus will be on questions that have been frequently asked in the NCLEX exam. Let's begin the video. One day after cataract surgery, the client is experiencing difficulty from bright lights. The nurse should advise the client that A. 1 week should be spent indoors with the lights dimmed. B. When exposed to direct sunlight, attach sun shields to your existing spectacles. C. When exposed to bright light, use sunglasses that wrap over the side of your face. D. Cover the operated eye when in bright light. Correct answer is C. Use sunglasses that wrap around the side of your face when in bright light. The client should wear sunglasses that cover the front and sides of their face to reduce the amount of light that enters their eyes from all angles and prevent discomfort from strong light. Staying inside or in low light is not required. Sunglasses or sun shields attached to prescription glasses won't block out enough light to prevent harsh light from entering the face's side. It is not required to cover the afflicted eye. After surgery to remove a cataract, the patient will need to wear glasses. Which of the following should be included in the teaching plan created by the nurse? Choose every option that pertains. A. Pictures will seem to be 3 times larger. B. Look via the glass's central aperture. C. There will be instantaneous changes. D. When descending steps, use the handrails. E. Avoid the sun for 2 weeks. Correct answers are A, B, and D. Images will appear to be 1/3 larger. Look through the center of the glasses, and when descending steps, use the handrails. After cataract surgery, wearing glasses does not completely restore binocular vision. The wearer should stare through the center of the glasses and swivel their head to examine items in the periphery, as wearing glasses will distort peripheral vision and make images appear larger. Until the client has adapted to the change in vision, they should also exercise caution when walking or ascending stairs. After cataract surgery, changes in vision are gradual, and the nurse can advise the patient to be patient as they get used to the new eyesight. It is not necessary for the client to avoid the sun, although wearing dark glasses can help reduce discomfort due to photophobia. The patient had a cataract surgically removed. What should be included in the discharge instructions provided by the nurse? A. Maintain a straight head alignment. B. Make use of strong lighting in your house. C. At night, wear an eye shield. D. As needed, replace the eye patch. Correct answer is C. At night, wear an eye shield. Rubbing the eye at night can be avoided by using an eye shield. To compensate for reduced peripheral vision, the head should be tilted to the side in order to scan the full visual field. Bright light sensitivity may initially be a side effect of eye medicines, and on the second postoperative day, the surgeon replaces the eye patch. Before we move on to the next question, we have urgent news for you. We've meticulously crafted a 100-hour animated NCLEX review crash course, and for this month only. In the initial 30 hours, we comprehensively cover all the crucial NCLEX topics with engaging animations, but that is just the beginning. The remaining 70 hours are dedicated to dissecting 5,000 NCLEX questions through dynamic animations. Along with animated lectures, you will also get NGN questions, an ebook, practice test series, and many more resources. Imagine learning with interactive visuals instead of being buried in a mound of tedious text. Say farewell to monotonous study sessions and welcome a revolutionary animated learning experience. This 100-hour course is your passport to mastering the NCLEX exam with unwavering confidence. Remember, animation significantly enhances information retention. Don't miss out on this limited time offer. We're offering an astounding 70% off for this month only. Click the link below, enroll today, and embark on a journey where animated education leads to exam triumph. Your success story begins now with our 100-hour animated NCLEX course at an incredible 70% off. Enroll immediately and wave goodbye to dreary textbooks. Now, let's swiftly move on to the next question. The nurse is informed by the cataract patient that he or she fears being awake during eye surgery. Which of the nurse's answers below would be the most suitable? A. Have you ever experienced any adverse reactions to local anesthesics before? B. What about the thought of being awake bothers you? C. You won't experience nausea and vomiting following surgery because a local anesthetic will be used. D. Being awake really is nothing to fear. We'll give you some medication to help you unwind. Correct answer is B. What about the thought of being awake bothers you? A patient who appears to be afraid about surgery should be given the chance to communicate her feelings to the nurse. The nurse can only adequately intervene once she has determined what worries the client has. While it might be appropriate asking the client about their prior experiences with local anesthetics, it does not directly address their worries in this particular situation. Reassuring the client that she won't feel queasy or throw up dismisses her fears and gives no information about how the client is feeling. The nurse could better arrange care with more information. Reassuring the client that she has nothing to fear downplays her emotions and fails to attend to her worries. Clairvoyance and hasty justifications fail to gather the necessary evaluation information and disregard the client's emotions. A client reports to the nurse that her vision has been blurry and cloudy all day. Which of the following recommendations should the nurse make to the client? A. Buy a pair of magnifying glasses. B. Wear glasses with colored lenses. C. Set up an appointment with an optician. D. Make an appointment with an ophthalmologist. Correct answer is D. Make an appointment with an ophthalmologist. An ophthalmologist is a specialist who specializes in the treatment of eye diseases, and the nurse should refer the client to a physician. An optician manufactures glasses, and it is unclear at this time what the optimum treatment option is for the client. Magnifying glasses or glasses with colored lenses may not correct hazy or blurred vision. If glasses are required to address refractive problems, they must be prescription glasses. Before cataract surgery, the nurse will inject drops of phenylephrine hydrochloride, also known as nclex-rn, into the patient's eye. Which of the following describes the anticipated result? A. The pupil and blood vessels dilate. B. Blood vessel constriction and pupil dilation. C. The blood vessels and pupil both contract. D. Blood vessel dilation and pupil constriction. Correct answer is B. Blood vessel constriction and pupil dilation. When phenylephrine hydrochloride, also known as nclex-rn, is injected into the eye, it acts as a mydriatic, causing the pupil to dilate. Additionally, it narrows the tiny blood vessels in the eyes. The patient suffers nausea shortly after cataract surgery. First, the nurse ought to A. Tell the patient to breathe deeply a few times until the nauseous feeling goes away. B. Clarify that this is a normal emotion and that it will soon pass. C. Advise the patient to contact the nurse right away if vomiting occurs. D. Administer an ondansetron injection to the patient as directed by the doctor. Correct answer is D. Administer an ondansetron injection to the patient as directed by the doctor. The client should be given a recommended antiemetic as soon as they feel nauseous after having their cataract out. After eye surgery, vomiting should be avoided as it might raise intraocular pressure and lead to problems. It's unlikely that deep breathing can help with nausea. Post-operative nausea is not uncommon, although it might cause vomiting and doesn't always go away fast. It's insensitive to the client's desire for comfort and intervention to avoid complications to advise them to contact only if they vomit. Following cataract surgery, which of the following potential complications may occur? Select all that apply. A. Vision loss. B. Rupture of the posterior capsule. C. Suprachoroidal hemorrhage. D. Retrobulbar hemorrhage. E. Acute bacterial endophthalmitis. The correct answers are options A and E, vision loss and acute bacterial endophthalmitis. One instance of acute bacterial endophthalmitis can arise out of every 1,000. Usually Staphylococcus epidermidis, Staphylococcus aureus, Pseudomonas, and Proteus species are the organisms involved. One consequence of an acute bacterial infection is vision loss. Furthermore, opacification of the posterior capsule or malposition of the intraocular lens implant may cause visual loss. A consequence of anesthetic agent retrobulbar infiltration, retrobulbar bleeding, can happen just before surgery. During surgery, risks can include suprachoroidal bleeding and posterior capsule rupture. The client is receiving post-operative care instructions from the nurse after having a cataract removed. Which position ought the nurse to instruct the patient in using? A. Hold yourself in a semi-Fowler's position. B. Put your feet farther up than your body. C. Lie on the operative side. D. Put the head in a position of dependence. Correct answer is A. Hold yourself in a semi-Fowler's position. The client should be instructed by the nurse to stay on the non-operative side or in a semi-Fowler's position. The operational eye is unaffected by raising the feet higher than the torso. However, putting the head in a dependent position may cause the intraocular pressure to rise. A patient who has had cataract surgery will need to keep applying eye drops to the damaged eye when they get back home. After administering the eye drops, the client is told to gently press on their nose at the inner canthus of the eyes. When pressure is applied, the following is what's anticipated to happen. A. Stop the drug from getting into the tear duct. B. Stop the client's face from being dripped with the medication. C. Permits the medicine to be absorbed by the delicate cornea. D. Makes it easier for the drug to be distributed across the surface of the eyes. Correct answer is A. Stops the drug from getting into the tear duct. After giving eye drops, apply pressure to the inner canthus of the closed eye to stop the drug from entering the lacrimal tear duct. The drug may be absorbed and result in toxic symptoms in the nose and throat if it gets into the tear duct. The lower conjunctival sac of the eye is where eye drops should be applied. As long as the drops are inserted into the eye, applying pressure won't stop the medication from dripping down the face. Pressure has no effect on the cornea and helps the drug be distributed evenly throughout the surface of the eye. To minimize intraocular pressure post-cataract surgery, what instructions should the nurse provide to the client to avoid? A. Lying flat on their back. B. Engaging in vigorous coughing. C. Performing deep breathing exercises. D. Walking or ambulating extensively. Correct answer. B. Engaging in vigorous coughing. Coughing should be avoided after cataract extraction as it can elevate intraocular pressure. Additionally, activities such as turning to the operative side, sneezing, crying, and straining are also contraindicted due to their potential to increase intraocular pressure. On the contrary, lying supine, ambulating, and practicing deep breathing are not known to impact intraocular pressure. The patient is advised to report any severe discomfort in the operative eye following cataract removal surgery, as this may be a sign of which of the following post-operative complications? A. A detached retina. B. The iris prolapses. C. Extracapsular erosion. D. Hemorrhage inside the eyes. Correct answer. D. Hemorrhage inside the eyes. After cataract removal surgery, sharp pain in the operative eye warrants immediate attention as it could indicate the development of an intraocular hemorrhage. Intraocular hemorrhages refer to bleeding within the eye, which can lead to increased pressure and potential damage to the delicate structures of the eye. The patient's right eye is diagnosed with a detached retina in the emergency room. Which task should the nurse complete first? A. Put compresses on the affected eye. B. Tell the client to lie on their abdomen. C. Take out every cushion on the bed. D. Encourage policies that restrict movement. Correct answer is D. Encourage policies that restrict movement. Encouraging actions that restrict movement could prevent additional injuries. If necessary, cool or warm compresses are administered to edematous eyelids after surgery to repair a detached retina. Prior to surgery, the patient should refrain from bending, stooping, or lying face down, and it is not required to take out every pillow. A patient with a retinal detachment should wear eye patches in both eyes. Patching is supposed to do the following. A. Decrease quick eye movements. B. Reduce the irritability brought on by light penetrating the injured eye. C. Prevent an infection in the wounded eye. D. Give your eyes a break to aid in healing. Correct answer is A. Decrease quick eye movements. The erratic eye movements that could amplify and aggravate retinal detachment are lessened when the eyes are patched. While avoiding infection is crucial and light sensitivity is common in customers with eye injuries, the main objective is to lessen fast eye movements. The patient who has a right retinal detachment expresses great fear to the nurse, saying, "I'm afraid I'll go blind. Living that way would be really difficult." What aspect of this remark should the nurse take into account before answering? A. If this technique fails, eye loss is guaranteed because repeat surgery is not possible. B. The left eye's vision is intact. The surgery will just postpone the right eye's blindness. C. A growing number of programs are offered to assist recently blind individuals in adjusting to daily life. D. The 90% to 95% success rate of surgical treatment justifies optimism. Correct answer, D. The 90% to 95% success rate of surgical treatment justifies optimism. Untreated retinal detachment worsens over time and eventually ends in blindness. However, surgery can effectively heal 90% to 95% of patients. About 10 to 14 days following the initial surgery, the surgical process might be repeated if necessary. Although there are many more services available for recently blind individuals, this client should ideally not require them, and blindness is not postponed by surgery. Which of the following best describes what an individual receiving treatment for retinal detachment should do throughout their rehabilitation period? A. Activity is progressively resumed. After 5 to 6 weeks, the client can get back to their regular schedule. B. The client's tolerance determines the amount of activity. They are free to be as active as they choose. C. The client can expect to be sedentary for a few months since their degree of activity will be limited. D. Clients can continue their regular aerobic exercises and their activity level can return to normal. Correct answer is A. Activity is progressively resumed. After 5 to 6 weeks, the client can get back to their regular schedule. It takes time for the retinal tear scars to fully heal. As a result, activity should be resumed gradually. The client may get back to their regular schedule in 5 to 6 weeks. A client who is healed well should be able to resume their prior level of functioning. Which of the following objectives should a patient who has had retinal detachment surgery prioritize? A. Manage discomfort. B. Prevent the intraocular pressure from rising. C. Encourage a diet low in salt. D. Continue to keep the area dark. Correct answer, B. Prevent the intraocular pressure from rising. The main objective following surgery for a detached retina is to avoid elevated intraocular pressure. The second objective is to use analgesics to control pain. For this customer, keeping a gloomy environment or adhering to a low-sodium diet are not goals. 2 drops of acetazolamide will be administered topically to a glaucoma patient's left eye. How ought the nurse to respond? A. When giving the medication to the patient in the left eye, ask them to close their right eye. B. While the nurse is giving the eye drops, ask the client to look up. C. While the nurse places the hand with the dropper on the client's forehead, ask the client to raise their eyebrows. D. After the drops are administered, use a tissue to wipe the eyes. Correct answer. B. While the nurse is giving the eye drops, ask the client to look up. While the nurse is administering the eye drops, the patient should look up. The patient must maintain both eyes open as the nurse gives the medication. When the nurse places her palm on the client's eyebrows and the client raises them, the movement of the forehead could cause the dropper to shift and damage the eye. Following the injection of the eye drops, the patient should gently blink their eyes. Some of the medication may be removed by wiping the eyes with a tissue. Extra fluid can be wiped out with a cotton ball. How does glaucoma damage my eyesight? A patient who has been receiving treatment for chronic open-angle glaucoma, COAG, for 5 years asks the nurse. The nurse should base her response on the understanding that chronic open-angle glaucoma A. is the outcome of persistent ocular inflammation. B. results in an elevation of intraocular pressure. C. causes the retina to separate. D. is brought on by the retina's reduced blood supply. Correct answer. B. results in an elevation of intraocular pressure. Increased intraocular pressure results from a blockage to the aqueous humor's outflow in COAG. The retina's nerve fibers eventually deteriorate due to the elevated intraocular pressure. This damage to the nerves results in painless blindness. It is unknown what causes glaucoma specifically. Retinal detachment is not a consequence of glaucoma. When evaluating a patient with chronic open-angle glaucoma, COAG, the nurse should look for A. eye discomfort, B. a lot of lacrimation, C. flashes of colored light, D. a reduction in peripheral vision. Correct answer is D. a reduction in peripheral vision. Peripheral vision rapidly diminishes as COAG advances, despite the fact that the condition is typically asymptomatic in the early stages. Although it is not a characteristic of COAG, angle closure glaucoma patients frequently experience eye pain. While excessive lacrimation may be a sign of a blocked tear duct, it's not a symptom of COAG. One common sign of retinal detachment is bright flashes. Before we move forward, here's some exciting news. Our 100-hour animated NCLEX review course is now available at a whopping 70% discount for this month only. In the first 30 hours, we cover all essential NCLEX topics with engaging animations. Then, dive into 5,000 NCLEX questions all brought to life with dynamic animation. Plus, you'll get access to NGN questions, an ebook, mock tests, and more. Say goodbye to dull textbooks and hello to an interactive learning experience. Enroll now and secure your success with our animated NCLEX course. Click the link in the description box to get started. Which of the following details should the nurse provide the client in order to get them ready for tonometry? A. Prior to the procedure, oral pain medication will be administered. B. There are no side effects and the process is painless. C. Following the surgery, you can experience double or blurry vision. D. Prior to the surgery, medication will be administered to dilate the pupils. Correct answer. B. There are no side effects and the process is painless. Intraocular pressure can be measured with tonometry, a straightforward, painless, and non-invasive process that has no side effects and doesn't require any special preparation or post-operation care. Pupil dilation is not required for tonometry. Timolol maleate eye drops are used by a client. This medication is intended to control glaucoma by A. Constricting pupils. B. Expanding the Schlemm canals. C. Decreasing production of aqueous humor. D. Strengthening the ciliary muscle's contraction capacity. Correct answer. C. Decreased production of aqueous humor. Timolol maleate is extensively used to treat glaucoma. The drug's function is not well known, however, it is thought to inhibit aqueous fluid production, lowering intraocular pressure. Timolol does not constrict the pupils, whereas miotics do. Timolol does not dilate Schlemm's canal. The nurse monitors the client while administering eye drops. The patient states, "I just try to hit the middle of my eyeball so the drops don't run out of my eye." The nurse informs the client that this procedure may cause A. Scleral straining. B. A corneal injury. C. Excessive lacrimation. D. Systemic medication absorption. Correct answer. B. A corneal injury. The cornea is delicate and might be harmed if eye drops fall on it. To avoid corneal injury, eye drops should be administered into the eye's lower conjunctival sac. The drops do not result in scleral discolorization or severe lacrimation. When eye drops penetrate the tear ducts, they are absorbed systemically. Which of the following clinical signs of acute angle closure glaucoma should a nurse look for in a patient? A. A gradual loss of eyesight in the center. B. Extreme sensitivity to light. C. The inability to see color. D. An unexpected eye ache. Correct answer. D. An unexpected eye ache. Iris angle abruptly changes as a result of acute angle closure glaucoma. Severe eye pain, colored halos around lights, and sudden vision loss are examples of clinical signs. Macular degeneration is correlated with a progressive loss of central vision. Achromatopsia, or the loss of color vision, is an uncommon symptom that arises from injury in the fusiform gyrus following a stroke. Usually, just half of the vision field is affected. Angle closure glaucoma in acute phase has been diagnosed in a client. The client's nursing care is planned by the nurse with the knowledge that acute angle closure glaucoma A. Usually goes away on its own without treatment. B. Usually requires extended bed rest for treatment. C. Is a medical emergency that has the potential to cause blindness quickly. D. Steroid therapy is the most typical kind of treatment. Correct answer. C. Is a medical emergency that has the potential to cause blindness quickly. If neglected, acute angle closure glaucoma is a medical emergency that quickly results in blindness. Miotic medications and surgery, usually an iridectomy or laser therapy, are the commonest forms of treatment. The aqueous humor can enter the anterior chamber through the hole made in the iris's periphery by either method. Acute angle closure glaucoma does not progress differently while a person is bedridden. In actuality, steroids are linked to the onset of glaucoma and are not a treatment for acute angle closure glaucoma. An elderly person with macular degeneration should be evaluated by the nurse for A. Central vision loss. B. A reduction in peripheral vision. C. Complete lack of vision. D. A blurry vision.
Stand Coast.
Correct answer, A. Central vision loss. Loss of central vision is typically associated with macular degeneration. As the condition worsens, gradual blurring of vision may occur and may even cause blindness. However, the most frequent diagnosis is loss of central vision. Drusen, which are little yellowish patches, form behind the retina. One of the hallmarks of glaucoma is peripheral vision loss. A client has experienced macular degeneration in the past. The primary nursing objective while in the hospital will be to A. Educate patients with adult macular degeneration, AMD, about community resources. B. Offer medical attention linked to the tracking of ocular health. C. Encourage a secure and efficient atmosphere for care. D. Make vision better. Correct answer, C. Encourage a secure and efficient atmosphere for care. In general, AMD impairs central vision. The inability to see clearly and the changes in the surroundings might lead to confusion. Consequently, the main objective of this client's care is to ensure their safety. It may have been possible to monitor his AMD or educate him about local options earlier, or to wait until after evaluating his level of experience and understanding of the illness process. It might not be able to improve his vision. As a safety precaution, which technique should the nurse instruct the adult macular degeneration AMD client in? A. Cover one eye with a patch. B. Arrange personal belongings on the visible side. C. Lay in bed with the side that is unaffected facing the door. D. As you walk, turn your head side to side. Correct answer, D. As you walk, turn your head side to side. The partially sighted client should be trained to swivel their head side to side as they walk in order to increase their range of vision. Failure to do so could lead to mishaps. By using this method, you make the most of your remaining vision. A fix does not solve the hemianopsia issue. While it won't compromise safety, situating the client and personal belongings appropriately will help them handle the situation better. The nurse notices that the client is staring straight ahead when she walks into the client's room. Which of the following actions is the nurse's best line of action going forward? A. Call an interdisciplinary meeting as soon as possible on the client's behalf. B. Seek advice from psychiatry. C. Pay attention to the client's body language and listen to them. D. As soon as you walk into the room, greet the client by name. Correct answer, C. Pay attention to the client's body language and listen to them. The nurse may be able to learn more about the client's physical and mental state by observing the client's body language and listening to them when they talk. When a client does not provide consent, the nurse should not use their first name. It would not be proper to visit with psychiatry unless the primary care physician prescribed it. The nurse would not be able to determine why the client is staring directly ahead of them in an interdisciplinary meeting. And maybe the client is just lost in contemplation. A client with recently developed vision loss is being helped by the nurse as they go from the hospital to their house. The client's right eye is the only one that can see light and shade. Which of the following is the client's greatest risk when they are at home? A. Sensory perception is lost. B. Fall-related injuries. C. Refusing to accept altered vision. D. Seclusion from communal events. Correct answer, B. Fall-related injuries. The client is at a greater risk of damage due to their recent loss of vision. Changes in senses frequently impact several aspects of functioning, putting those with sensory deficiencies at danger of harm. Changes in sensory function may be accompanied by concerns about disturbed sensory perception, denial and difficulties adjusting to the eyesight loss, and social isolation. Nonetheless, these issues are not more pressing than the risk of damage.